Alright, so talking about tuberculosis. First of all, tuberculosis is defined as a contagious airborne bacterial infection caused by Mycobacterium tuberculosis, and it primarily affects the lungs, right? Now, let's say a patient comes with chief complaints of low grade fever, which is below 101.5, chronic cough, which must last for greater than 2 weeks, night sweats, weight loss, loss of appetite, and in severe cases, hemoptysis also. We'll do examination of patient, we'll do GPE, which will say the paler appearance of the patient. Then we'll go for investigation, that is sputum for acid fast bacilli, chest x-ray, and gene export test, which is for multi-drug resistant TB. Now we will talk about the management of the patient before the results of the test, right? So we'll do symptomatic treatment before the results. That is, we'll give levofloxacin, that is tab Elsin, 250 milligram twice daily. We'll give tab Panadol 500 milligram for fever twice daily, and we'll give syrup Bretanil for cough, right? Now coming towards the TB management after the result is positive. So first of all, we will calculate the weight of the patient and start ATT, that is anti-tuberculosis therapy. The main drug is tabmyrin P40, which contains isoniazid, rifampicin, ethambutol, and pyrazinamide. According to the weight of the patient, if the weight of the adult is up to 39 kg, then 2 tab early morning. If weight is 39 to 45 kg, then 3 tablets will be given early morning. If weight is greater than 45 kg, then 4 tablets early morning. Remember, this treatment is for 6 months. Now, to overcome the side effect of isoniazid, which is peripheral neuropathy, we will give tab Vita 6 50 mg one at night. And for fever, we will give tab Panadol, and in case of cough, we will give syrup Bretanil, or we can give Hyloxine also. Thank you very much. Alright, so talking about bronchial asthma now. Let's suppose a patient with chief complaint of shortness of breath comes to you, and he says that my symptoms gets worsen at night, and has also experienced seasonal variation. So these are the symptoms of asthma. I will go for examination now. I will take vitals of the patient, so his respiratory rate will increase, and if his temperature is also increased, it means that he has bacterial infection alongside with productive cough also. Now I will differentially diagnose COPD now. Now talking about the management for acute attack of asthma. If a patient comes to you, comes to the hospital, so I will write injectable steroids directly, and it can be injection dexamethasone or injection dicodoron 1 ml IV state, and I will put the patient on nebulization, which is ATEM and Clenil. ATEM is basically ipratropium, which is bronchodilator, and beclomethasone is steroids. Then upon discharge of the patient, I will put the patient on medication also. First of all, I will write antibiotics in case of temperature and productive cough, which is levofloxacin, which comes under the name of Elsin 250 milligram BD, augmentin 625 milligram TDS for 5 days, also Mofist, which is moxifloxacin, that is 400 milligram OD for 5 days. I will also write antihistamine to the patient, which is leukotriene receptor antagonist, that is tab Montecop or Montejet, which is basically Montelukast, that is 10 milligram. I will also write tab Regex to the patient, which is basically cetirizine, tab Sidil in case of pregnant female, and for cough, I will write cough syrup, which is acifile or hydralene. Thank you.